Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Anti-Müllerian Hormone or AMH predicts quantity, not competence of eggs. Let's find out. Anti-Müllerian hormone has become one of the most discussed fertility tests today. Patients often hear statements like your AMH is high, pregnancy will be difficult, or your AMH is high, your fertility is excellent. But here is the scientific truth. AMH tells us how many eggs you have, maybe available for a procedure or for treatment, but not how good those eggs are. Understanding the distinction is critical for realistic fertility counseling. So what actually does AMH measure? AMH is produced by granulosa cells of small antral and pre-antral follicles in the ovaries. It reflects the size of the remaining follicle pool, the ovaries' likely response to stimulation, and how many eggs might we retrieve in an IVF cycle. However, AMH does not assess the egg chromosomal normality, mitochondrial health, or DNA integrity. It also does not tell us about the developmental competence of the egg. In short, AMH is a quantitative marker, not a qualitative one. So why quality plus competence is important? Egg competence refers to an egg's ability to mature correctly, fertilize normally, divide into healthy embryos, implant and sustain pregnancy occur. They depend on mitochondrial energy supply from the egg, spindle integrity, epigenetic programming, chromosomal segregation, but none of these are reflected in an AMH value. This explains why women with low AMH can conceive naturally, or women with high AMH can still experience implantation failure or miscarriage. The role of age in biology also plays a very important role. Egg quality is primarily age dependent, not AMH dependent. As a woman ages, chromosome errors increase, mitochondrial competence declines, meiotic spindle errors rise. So if a 38-year-old woman with high AMH may have more eggs, it doesn't mean that higher the proportion of them, the lower the chromosomal abnormality. In fact, conversely, a younger woman with low AMH may produce lesser eggs, but a higher percentage of them may be genetically competent. So what is AMH actually best used for? In clinical practice, AMH helps us individualize IVF stimulation, treatment modules, protocols. It also helps us in predicting ovarian response and counseling about egg freezing yield. You can also plan fertility preservation timelines based on your AMH, but it should never be used alone to predict pregnancy potential. So, what is the right interpretation? AMH is an important tool, but only when interpreted correctly. It predicts how many eggs we might get, not how capable those eggs are of making a baby. Fertility is not a single number, it is the integration of egg biology, uterine receptivity, sperm health, and timing. Understanding this distinction empowers better decisions and prevents unnecessary fear. If you wish to know more about this, please feel free to contact us. Thank you.